They might do the time, we can let them in. I'll give a landline to you, Miss Queen.
Okay, cool. I am too. I'm ready to be asleep. Exactly.
Yes, ma'am. Application should withdraw. And I want you to go ahead there. Absolutely.
Yeah, and you need that to do big things. Yes, I mean, when I did my job, I had a team. I knew that I had to start training. Because they needed to be. And now we're, as soon as that's. Things took off, you know, so. And you can tell.
That's what kids do.
That's what.
I mean, that every time.
Yes, you're right. You are right about that.
Right here, among those two regular dance. Irony that you're sitting right next to.
I know.
And I have.
Maybe y'all did a great job.
You did so good. Really? Yes. I think that's excellent. Good.
That's great to hear you all. We already had 30 surveys.
Well, you know what? So when right. Yes. Yes.
Yes.
I understand.
They're ready. They're about to.
They're tired.
Information for
I'll make up the
detention.
coffee and they're tired. They'll give you responding.
No, that's it, right there.
That's just as good.
If not better.
As we look
As
at
we look at
this.
this.
I did put the bottle in the floor, so. Because I thought it was available for anybody. I think it's candy.
But I had a drink out of it.
Erica said she can't fit in.
Yeah, Andrea today just texted me the same thing. Andrea today was gonna watch the meeting. She said they're fine.
So Mary Pat says, I can't get it in the meeting, so I'm gonna call in, is what she's saying. Yes. Okay, so
Give her. Where said she was gonna give her. Give her first one. If she can get it.
Good afternoon, everyone. We'll go ahead and call the Early Childhood Advisory Council for March 16th to order. Megan, if you can, please do our roll call.
Brittany Howe. Amy Hood.
I'm here.
Brittany, I'm so sorry. Brittany Howe is present.
Tracy Stimmel. Amy Smith. Dr. Felicia Cummings Smith. Anita Dowd. Dr. Annette Bridges. Rena Gratz. Danny Carroll. Scotty Collier. Dr. Connie White.
Here. Connie
Dr.
White, I'm here.
Dr. J. Sook Gilbert.
Here.
Dr. Jason Glass.
Bill Buchanan representing Dr. Glass.
Thank you. Eric Freelander. John Roden.
Here.
Kim Fithian. Lieutenant Governor Jacqueline Coleman. Kim Banta. Paula Goff.
Here.
Lynn Baker.
Here.
Dr. Sarah Vanover.
Here.
Travis Burton. Twyla Burdette. Greta McKenzie. Beth Morton.
Here.
Dee Dee Cummins.
Here.
Secretary Jamie Link. Thank you.
This
Thank you
is
very
Mary
much,
Pat
Amy.
Regan. I'm sitting in for Secretary Link.
Thank you very much, ma'am. So we are right on time as we're getting ready to go through and where we have a hybrid of doing in person and also having Zoom members. Just so as we're going through, if we are speaking, if those members on Zoom and also that are in the room here present, if you can announce who it is that's speaking or making a motion, that way everybody knows and we have an account for it as well. The first order of action that we have today in front of us is the approval of the minutes from the December 16th, 2021 meeting. Those were emailed out to members last week. For those that are in person, they're in the right side of the packet that's in front of you. If you can, if you have not yet, please take a moment to review those. And after reviewing, we will entertain a motion to approve.
I'd like to ask for a motion.
I have a motion. Is there a second?
Rena Gratz, a second.
It's been properly motioned and second. All those in favor of approval, say aye.
Aye.
Any opposed? Motion carries. Moving next, we have our executive director's update with Executive Director Amy Neal.
Okay, can everybody hear me all right? Okay, this is super exciting. This is our first meeting in person since I've become the executive director in May. So I cannot tell you how thrilled I am to see everyone in person. It's just really exciting. So I'll try to keep this short. You have, I believe, a copy in your packet. I've got a couple categories I want to cover as usual. Workforce, partnership, communication, and data insights. Under early childhood workforce, regarding our early childhood standards, as you know, they've been refreshed. June is coming up very quickly. That's when we're going to have our full release of the early childhood standards. with our interactive platform that'll be live in June. We're working on a unified training. We're so thankful that Dr. Amy Hood and Mary Howard are leading that effort. And we're also working with National Center for Families Learning to refresh our companion piece, which is the parent guide. Under partnerships, I am so proud of Megan Greenwell, who has done a tremendous job facilitating some great conversations across the Commonwealth. This year, we know for certain that we have we're going to have 3 confirmed new regional collaboratives. I mean, it's just amazing. That's been a lot of time and effort on her part, bringing a lot of partners together. It's our office being really proactive about the work. And I'm just really proud of Megan for doing that. And I appreciate her for doing that. We also have a 4th regional collaborative who are sort of like on their way. So it's pretty exciting. Thanks for the thumbs up, Rena. I see it. Under communications, congratulations to Senator Danny Carroll, also to Sarah Vanover. A couple months ago, they were recognized by Kentucky Youth Advocates for Champions for Children. And so we wanted to just make sure and give that shout out. So congratulations. Melissa Goings is not an official member of our Early Childhood Advisory Council, but daggone it, we couldn't do the work without our Family Resource and Youth Service Centers. And Melissa Goings was recognized. And so I also wanted to give her a shout out. Under data insights, you can take a look at the executive director report, but I just wanted to call out sort of 3 data points from one of our last statewide webinars for transitioning to kindergarten. 91.2% of participants learned something new. 97.1% understand the role of regional collaboratives in the Governor's Office of Early Childhood Strategic Plan and how important they are to its future success. And 97.1% can start using the information they learned today immediately in their community. So we're not mad about that data. And then last but not least, so many of you all have been with us the past 2 days at our Early Childhood Institute. I was bragging on my team earlier, so I'm not going to brag on them, but who I am going to brag on are our leaders right here at the table. We had so many of you all who were presenters, Twyla and Beth and Sarah and Rena and Brittany and Jason, Dr. Glass, Commissioner, Amy Smith. I mean, fantastic. Thank you. I see I have 5 minutes. We had ambassadors. We had Scotty Collier, who runs a school building and was here with us for 2 full days. We had Kim Fithian. We had Annette Bridges, who attended the conference. Thank you for your leadership. Thank you for being here, for your advocacy and your commitment. We just can't do the work without you. So thank you so much. Thanks.
Thank you very much, Amy. And even though Amy was not going to brag on the team in public, I think that it goes without saying that we as the Early Childhood Advisory Council want to brag on you and the work that your team has done, because we know the work that goes on to it. So the next part that we're having is, you can see on the agenda, we have a full agenda and we have a compressed amount of time. And I promise you, we will get through everything. And we're going to try to do it on time. So we'll kind of move to our next item. And that'll be our partner agency updates. As we remember, one of the things that ECAC requested through the evaluations was for participation and for conversation. So we have the pre-reads within the packets that's come out for us as well. And we have members of some of our partners that are selected. And the first one we'll have, and it's joining by phone, is Acting Secretary Mary Pat Reagan with the Labor, Education, and Workforce Development Cabinet. So Secretary Reagan, if you can go ahead and provide your update,
Sure.
please.
Can you hear me?
Yes, ma'am. Yes, ma'am, we can. So we love technology whenever it's all working very well. So what we'll do is while we are trying to reconnect with the secretary, we'll kind of move forward. And whenever she's able to join, if we can, we'll kind of pause just to loop back in. Bill Buchanan with the Kentucky Department of Education is here today, and he'll be providing the update for KDE. Bill, and for all speakers that are sharing, if you can come to the microphone, just that way that those in the classroom and in the classroom, you can tell I went back, put a different hat on from a long time ago, but those within the room and on Zoom can hear you.
Nice. Yes, I like to think of us as early educators in the classroom. And I'm happy to share a couple of updates with you from the Department of Education. First, the impact survey results have been released, and this is data that is collected from school staff, including teachers and leaders. The data indicates that there is some strength among staff and leadership relationships, but as we know, there's still a lot of challenges with teacher well-being. And so the results of, and we thank teachers deeply for participating in this data. We very much want to make sure that the decisions that we make in terms of our support, our service and support to school districts is based on data. So this information is very helpful. The agency has been providing sessions to schools to review the data and make plans accordingly. I want to share that the Preschool Coordinator Advisory Group it met back in January and during that time created 2 committees, an executive committee and a priority committee, and the next meeting is scheduled in April. And I have 2 more items to share with you that may not appear in the report, and that is the child count. So the preschool count, the preliminary numbers for March 1 have been received, and once approved by the budget office. And once we have a final budget enacted, Dr. Glass mentioned the importance of the budget bill during the luncheon today. So once we have a final budget enacted, preliminary amounts will be released. The per child rates for the state-funded preschool program would be reviewed by the Kentucky Board of Education for approval in June. Also, I want to share that preschool will be making a shift in terms of our assessment data. We will be moving to the Child Outcome Summary, the COS, from KEDS, the Kentucky Early Childhood Data System, in the fall of 2022. And COS the COS was created by the Office of Special Education Programs, OSEP, and is used by a majority of the states. This system collects data using a team approach to determine child functioning in 3 outcome areas. These 3 areas include positive social emotional skills, the acquisition and use of general knowledge, and the use of appropriate behaviors to meet needs. These 3 outcomes are evaluated on a 7-point scale. The key thing is that the assessments school districts are now using for preschool remain the same. What's really new here is it's about team approach to evaluating the data. These assessments are really good, but they don't necessarily assess in all areas. So we want to bring the expertise of our teachers to this process, and we hope to see great things from this in terms of alignment between assessment, curriculum, and instruction resulting from this change. More information about this will be shared with preschool coordinators during the leadership meetings in April. We are now in the process of finalizing communication and training plans around the COS, and very pleased to be able to share this information with you today. And with that, I'll turn it back over to you, John.
Thank you very much, Bill. Are there any questions that the members have regarding the update from KDE? If there are none, we'll move right along. Next we have Dr. Sarah Vanover with the Division of Child Care out of the Cabinet for Health and Family Services with her update.
Thank you all. As many of you know, a large portion of what has been going on at the Division of Child Care has been surrounding federal funds that are being released to child care programs through the American Rescue Plan, and actually finishing up some of the previous rounds of funding through the Corona Response Relief, CRISA Act, and different portions of those funds. We do have a lot of RFAs, requests for application, that are out right now on our website, including startup funds throughout the state for employee-based childcare and new childcare businesses in desert areas, up to $100,000 matching grants to establish new programs in areas that desperately need additional childcare. There are also startup grants for new family childcare homes throughout the state. And those applicants will partner with the Family Childcare Network in order to get the support they need to apply to be certified family homes and begin their journey as an entrepreneur. A large portion of the federal funds has been devoted to subsidy, childcare subsidy. And with that, not only has the Division of Child Care increased the reimbursement rate. So previously, before the pandemic, we were reimbursing full cost of 40% of the child care programs in the state. We've increased that rate to what was the federal recommendation previously, and that means that we would pay for the full cost of up to 80% of the child care programs in the state that wouldn't have an overage above that. We've also increased the eligibility. Initially, people prior to the pandemic qualified for child care subsidy if their income in their home was at 160% of the federal poverty level. We've increased that entrance point to 200% of the federal poverty level right now. And then we've added a cliff effect feature for families who have been on subsidy and eventually graduate out, instead of just a hard cutoff where we pay a large amount of money and then just stop. We have created an ease out kind of cliff effect feature to help families as they learn how to redistribute their funds and rebudget. With all of these features in place, I'm going to ask you all to partner with us in spreading the message to families that they may have never qualified for subsidy before, but they could possibly now. We are trying to get all of our partners to help share this message. We've got marketing, infographics and things that we're spreading through social media, websites. We're trying to tell childcare providers that they may have families that qualify. But the numbers have fluctuated somewhat during the pandemic because of the workforce numbers. We heard from the Thrive meeting that, on Monday, that the workforce numbers for families, for individuals who make over $27,000 a year, have pretty much returned to the level that they were pre-pandemic. But for individuals who make less than $27,000 a year, which unfortunately is a lot of our childcare providers, those numbers are still lagging to help people return to the workforce. And so as our subsidy enrollment numbers have fluctuated, we've had as many as 30,000 children enrolled in subsidy and as low as 21,000 at different points during the pandemic. However, if new families know that they can qualify and they have the opportunity to return to the workforce, that could make a huge impact. Thrive also shared with us last week that of the people that are still staying at home, 68% of those are women, and most of them say that the number one reason that they are still at home is due to childcare situations. And so those subsidy funds are very important that we share throughout the community, that new families may qualify now. And so we encourage you to support us in sharing that message. The Division of Child Care's All-Star program reopened in October of 2021. However, we gave child care programs the option to defer another year. Many of them are still struggling greatly with staffing. That is the largest outcry that we hear from child care programs throughout the state, is though even though they have raised their wages with the support of the American Rescue Fund dollars, they still cannot even get people to show up and interview for positions. Because of that, many of the childcare programs throughout the state have 2 to 3 classrooms closed and are not operating at even close to their maximum capacity. So then families in certain areas that are looking for childcare have nowhere to go because the centers can't work at their capacity. So with All Stars, knowing that the staffing demand has created a lot of additional burdens on the centers, we have allowed them to defer the All Stars program reevaluation for another year so that they do not lose their high quality status rating during this time period. But they still are sending in annual paperwork. We are trying to find new and creative ways to support our providers through training, through different avenues. The funds through the stabilization grants have been a huge asset to providers that had financial hardship during the pandemic, even up through now. But now the greatest challenge is the staffing piece. And I think that really is what all of our programs are having a hard time finding employees, making sure that our rates are competitive with other organizations and moving forward that way. So I would say that's going to be our focus in supporting our centers in the near future and possibly longer than the near future. But if there are other questions you have for me about the federal funding, about initiatives we're doing, we have a lot of training initiatives going on, a lot of TOTs. We're really pushing special education trainings throughout the community right now to make sure that our providers know how to work with children who have challenging behaviors. So we've done a lot of those efforts. And if you have questions for us, please feel free to reach out.
Yes, Dr. Bridges.
I'm back.
Dr. Vanover, I had some conversations yesterday with quite a few directors, childcare directors, and when you think about the STARS program, one area that's really a challenge for them, and that's the insurance benefit.
Mm-hmm.
So do you think, or could you maybe think about the possibility, because the problem is that it costs so much because they have such small numbers.
Mm-hmm.
So we were wondering if the state
Mm-hmm.
could have some kind of collaborative where all of these programs who are interested
Mm-hmm.
could be under one umbrella.
Mm-hmm.
So that, and maybe it'd be a shared cost so that the program or whatever could pay for part and then the employee could pay for part. But
Mm-hmm.
I just want to bring that to your attention. I know something that
Yeah, at the higher rating levels, when we get to a 3, 4, or 5 star, and Andrea or Amy, lots of people. Oh, okay. So there is a question about the higher rated programs and having insurance for employees as part of that. We know that employees stay longer at their job when they have benefits like insurance, paid time off, things of that nature. I will say that at the higher levels at 3, 4, and 5, there are points that you can collect. So not having insurance wouldn't prevent you from being a higher level center in that range, but it is a contributing factor. Now, as far as people looking for a job, yes, many people are looking for insurance when they apply for jobs. And so some centers that can't offer that, it does put them at a disadvantage. As far as the state collaborating, that's going to be a question above me because there would be a large financial investment piece in order to create that type of umbrella. But it is something that you can always ask questions about, see how other states have done. But I would not be the one that would necessarily be able to make a decision on piloting a program like that. Just to give you a little background.
could you maybe forward or higher up?
I'm good at forwarding
Okay.
questions.
Just open the conversation.
Not a problem.
Are there any other questions from those in the room or those that are on Zoom for Dr. Vanover? Practicing my wait time. Thank you, ma'am. I will echo what Sarah had said, and just bringing your attention back to that written report. There are a couple of things, those RFAs that are currently posted. This is one of those funding opportunities that we within early childhood look at and say, man, what could we do if, and I believe the flexibility that's within the DCC currently for childcare to open up new programs, new partnerships for business collaboration, and as well as looking at that multi-prong of increasing the reimbursement rates and allowing for more families to be eligible, getting the word out. And that's one of the things we as ECAG members, one of our chief responsibilities is to take information back to our local communities and our networks. So I just encourage you, don't let that one sit, get the information out so that everyone can take advantage of it so that we can have stronger programs providing higher quality.
And John, there is currently posted a $10,000 facility repair grant that every child care program can qualify for, even if they were not open by the cutoff of the stabilization. One-time facility repairs are so hard cost-wise on centers, $1,000 can really cost AC or roof repairs or new industrial washer dryer. and the application is easy.
Easy application, very flexible on the funding, as well as there are webinars and some of the Zoom meetings for the question answer sessions are online. So just throwing that plug in there as well. Still doing well on time. Next we have Paula Goff, the program administrator for Part C out of CHFS, to provide her update. Paula, are you still with us?
Yes, I am.
Fantastic. The floor is yours, ma'am.
All right, thank you. What's happening with our Part C program? Currently, we have our federal grant application on the website, the First Steps website, as it is posted for public comment. There's really not any change. What this will appear to people mostly is check marks that we have everything on file, which we do, and then the new budget. That's really the part that we have to update every year. And so that's what you will see. And you have, there's still plenty of time to make written comments about the federal grant application. We anticipate getting the funds, of course, by July 1. We have a new I call it a revised regulation, is probably a better way of putting it, that we have filed with the Legislative Research Commission. This regulation that we filed has to do with eligibility. And we have submitted and proposed to change the eligibility for hearing impaired. What would now be under the new regulation, any child with a delay in hearing, mild to severe, doesn't matter. And it also would not matter if it was unilateral or bilateral for first steps through the established risk condition. Our current regulation limits eligibility for hearing impairment to children who have at a minimum a 25 decibel loss in their better ear. So this would really be quite a change. We're looking forward to doing that, change in eligibility. Other regulations will be filed probably sometime later in the spring. It's always hard to tell when that happens. But those other regulations support this change in eligibility by adding some new procedures for children with hearing impairments in terms of how we evaluate them. There'll be an added assessment to look at their language abilities, as well as some services for families, and linking them with the parent support groups and services in that realm, as well as adding a provision to our regulations that would add a new provider type, which would be a parent of a child with a communication disorder such as hearing. So we really are pleased with that change. We worked closely with the Commission for the Deaf and Hard of Hearing, as well as with our early hearing detection program to craft these new regulations that will be coming kind of in a series, but the first change will be with eligibility. We are also in the midst of our provider enrollment process. We go through this every 2 years, so it's not a new process. What's new for us this year is, thanks to the pandemic, we were all introduced to DocuSign. And so we have gone to an electronic provider enrollment. We just started this month, and so far so good. We did start with the easier agencies, which are our independent providers. We haven't tackled large agencies yet, but we're pleased with how that process is working. For any of you who use DocuSign or have experience with it, there's a lot of upfront work that goes with that to create the pieces that get sent out to someone to do the electronic signing and reviews. And so our staff, led by Tammy Eisenberg, really did a great job with getting that piece up and running for us. And on the front of electronic wizardry, We also will soon be implementing a new security process to our database system. This is part of the requirements of working with the Cabinet for Health and Family Services. But our providers, any user of our data system, whether that's a provider or our point of entry staff, those of us at the state staff, et cetera, will need to go through the Kentucky Online Gateway in order to gain access to the system and be able to use it for their documentation and billing and other uses that we have for it at the state level. So we have some new changes coming along. I always say Part C stands for change. And so as we keep moving into the modern era, we do our best to keep up. So that's kind of where we are, business as usual. Our referrals are slowly climbing. We are not back to pre-COVID levels, but on a slow and steady pace to get there.
Thank you very much, Paula. Are there any questions for the members for Paula regarding the update from Part C? Just practice my wait time again. So we'll continue on. And in my excitement, I guess, of being here in person for the first time, I skipped over unintentionally our Head Start Collaboration Office update. So Ms. Lynn Baker, please forgive me. We're going to go ahead and we're going to round out our partner updates with you as well. Thank you, ma'am.
We filed our annual report for the Office of Head Start on January 28th. So that was great. That got turned in. It had all of the information about what we've done in support of the Early Childhood Institute, the standards work, all of our data collection efforts and supports for kindergarten readiness, and the work on the revisions and launch of the early childhood standards that will be coming in June. There have been several updates on masking and vaccine interim final rule. Kentucky is one of 24 states that filed a lawsuit against the mask and vaccine requirement, and there's a preliminary injunction halting the enforcement of the masking and the vaccine requirement in our state. Also, as of Monday, February 28th, the Office of Head Start has temporarily suspended monitoring for masks in light of the new guidance from the CDC. So the vaccine requirement is still in place for other states. The masking is not in place for any state as far as a requirement. And then there are updates on our federal monitoring for full enrollment. They are temporarily suspending monitoring for full enrollment due to the impact of COVID. However, enrollment and child find efforts are still being reported to the Office of Head Start. So that information is still there, but they are not monitoring or penalizing for that at this time. And those are all my updates.
Thank you, ma'am. Are there any questions for Lynn regarding the Head Start Collaboration Office update? With no questions, thank you all for sharing and presenting. And as we've said at our last meeting and continue on, if there's information or conversation or discussions regarding the reports or anything that is shared, members, please reach out to our partner agencies because we want to have that robust conversation so that we are keeping in line with what we said that we wanted to do, which was meet the goals of the Early Childhood Advisory Council. Speaking of which, as we get into the next section of our meeting, we've been providing the updates at each of these meetings regarding the priorities of the Governor's Office of Early Childhood. And these are always and have been based within the strategic plan that was updated based on the evaluation data that was collected through the Preschool Development Grant. So just reminding us what those priorities are is promoting greater collaboration among communities statewide, as we heard from Amy's report, giving the shout out for what Megan has been doing. So we have the 3 new regional collaboratives coming online, but it's continuing on. How do we develop these collaborations and develop that system in place? Also emphasizing quality and continuous improvement. And lastly, ensuring more children enter kindergarten prepared. If there's ever a time to focus on the preparedness of our children within the Commonwealth, which has always been important, coming out of the last 2 years, we have to double down on that as well. If we can move to the next slide, please. So if we look at our strategic plan, our priorities within the office, which Amy and the team had shared back whenever it first came on within the department, the Office of Early Childhood, it's those priorities, unification and accountability of the system with that focus on growing early childhood workforce. And then also the priority 2, strengthen and cultivate state strategic and local partnerships. So it's state level partnerships and local partnerships so that we're united and cross-sector partners to impact policy and practices positively. That was an alliteration that I almost stumbled on there, but policy and practice. So it's what we put down in within our code, and then how are we going to do it? That knowledge, skill, and practice, which are oh so important. So these next 2 updates that we'll have, the first one will be provided by Dr. Sarah Hannemeyer with Compass, Dr. Jessica Cunningham with Kentucky Stats, and Executive Director Amy Neal. So first, I'm going to give that for Kate Irish, who is also with Compass. You may remember her as a familiar face who worked quite hand in hand with Kentucky with the preschool development grant. So Kate, go ahead, ma'am.
All right. Thank you. Glad to be here in person in a cool gray sweatshirt. This is my new favorite place to present if I can wear a sweatshirt. Reminds me of my Zoom presentations. I'm really happy to be here to talk about this exciting project that y'all might be familiar with, to give some updates and highlights. So it's the Building Strong Foundations for Families project that's funded through 0 to 3. So the Governor's Office of Early Childhood was one of 10 states that was invited to participate in a project really looking at the needs of families with infants and toddlers, and looking at specifically wanting to look at policy solutions to the needs of families with infants and toddlers. So we'll kind of give some of the findings and updates and talk a little bit about next steps as well. So I think there's a couple things that are really exciting about this work. One is that the project was developed very collaboratively. And so the Investment and Alignment Committee formed an infant toddler work group of cross-sector some folks that might be in this room or on the call really helped formulate what this project would look like. And really wanting to look at what are sort of the key questions that we would want to try to answer or look at in terms of policy solutions. And so kind of starting with some of the preschool development grant work, the fiscal mapping, and really looking at infant and toddler programs, identifying sort of the systems questions around transitions. So are transitions happening smoothly for families with infants and toddlers in and out of programs? Are families able to access services that they need when they get the referrals? And just, generally, what can we learn from families about their experiences and how we might be able to improve services? Can we move to the next slide, please? So I know you all cannot probably read this, but I did want to just be able to talk a little bit about how we did this. So the other thing I think is really exciting about this work is that we really were able to lift up the voices of families and practitioners. So we did a bunch of focus groups, about 20 or so focus groups, both with families that were participants in programs and practitioners. So you'll see that it's a little bit cut off, but you can almost see that we really were focusing in on talking with families who had participated in HANDS, First Steps, or Healthy Start. So looking at those programs, those are programs that all receive federal funding and all have home visitation components. And so we also focused a lot on the needs of rural families. So the focus groups for the HANDS and First Steps projects were specifically talking with families living in rural counties. Healthy Start is the outlier, is the only one that's not rural, being in Louisville, but also a home visitation program that receives federal funding. So we were able to do focus groups and interviews. We talked with families, practitioners, state level partners as well. And we did sort of policy review and analysis. So this table is sort of first page of sort of many elements that we looked at across the three projects. Can you go to the next slide? So we're just going to go through some of the highlights. We have so much rich information, so many stories and quotes and things that families told us. And really, it was really touching to hear their experiences and hear from them. And we asked them specifically sort of about their transitions in and out of programs. So this slide is really looking at sort of the intake or how they got into the program and wanting to find out more about that. So, I think we found that all programs did a really great job of having relationship-based services, that families felt really good about the services they were receiving. But maybe that initial application process, the initial intake process, was more focused on paperwork and less on relationships. So that part, I think at times felt overwhelming to some families, filling out all the forms and maybe not understanding kind of what was next or where things were going. So definitely heard a little bit about sort of that initial intake process. Also, just kind of wanting to know how families found out about programs, sort of the awareness that families have. It seemed like a lot of it was word of mouth, folks in the community that had told them, a neighbor, a friend, family member. And also, that was important when families were talking about how they did start the services, because I think, we heard this from practitioners and families, there being a little bit of confusion about the service and what was being offered. And was this part of Child Protective Services or not? So that was a big factor in terms of trust and understanding what the project was going to do to support the family. We heard a lot about accessibility issues. While these programs are home visitation programs, a lot of the referrals, follow-ups and things did require transportation, and that is a significant barrier for families. We heard that again and again in every focus group. We heard the home visitation was good and that it helped families, in terms of scheduling and having multiple children. Being in the home was really helpful. But it was challenging to get out to referrals and to get to where they needed to go. Also, understanding sort of the eligibility parameters. Some programs have specific age requirements, for instance, like being in hands by the age of the child being 3 months, that kind of thing. So families wanting others in the community to know about some of those requirements so they didn't miss cutoffs and things like that. So I think kind of greater understanding about the eligibility factors for the programs. And then we heard, from practitioners, we heard a lot about, even in the initial intake and the initial into the program process, hearing a lot about sort of trauma experiences that families were facing, and families facing drug and substance abuse issues, and trying to sort of sort through how to work with that in even getting started in program services. And at times feeling like there being safety issues for the practitioner in starting services. So if we go to the next slide. So this is sort of when we asked, families are receiving services, but we asked them about sort of referrals and community resources, like needs for outside supports. And so I think this is where we saw, especially from the practitioners, that they do so much in their community to know what's out there, and that they have relationships in their community. And so it is sort of maybe more of an informal process. It's one that they have, invested a lot of time in to get these resources and referrals. But usually, like, every practitioner we talked to did it a little bit differently, had their own, little resource guide that they used, or they know someone in this agency. So it was definitely a critical part of all of the programs was making referrals, but some were less formalized than others, sort of the way that they went about doing it. And then again, accessibility being an issue. I already mentioned transportation. I think in some counties, when we asked families about referrals or practitioners about referrals, they kind of looked at us quizzically, like, referral to what? Like, what what should I refer to? There was a lack of other options and referrals in those communities. So we saw that. I think another accessibility issue to do with transportation was really around medical services. We were hearing in the HANDS focus groups a lot about families that were really driving great distances or having to go great distances to get their OBGYN, their delivery, their pediatric services. I think it both an access issue of things not being nearby, also some families not feeling comfortable with the medical services that are locally close to them. So we heard that as well. So that being a real struggle for families is to get the medical services they need in closer to them or more convenient to them. And then I think on the flip side of some families not having a lot of options and there not being a lot of community resources, we did find some families where they felt like they were sort of receiving a whole bunch of referrals at once and trying to figure out how to manage and maneuver, with multiple children, scheduling appointments, like things like that. And those were, again, the ones that really felt the home visitation was so beneficial to them that it saved them a lot of like time and effort in accessing that project. Okay. And then I think if we go to the next slide. So this has to do with transitioning out or graduating from the program. And so, we, as I said before, we heard time and time again that families were really pleased with the services and they had really close relationships with the workers that were coming into their homes and providing like a really critical emotional support. A lot of families feeling really isolated, especially in the times of the pandemic. And so it really did feel like sort of that cliff effect of when the service ended, they really felt at times they didn't have other resources. So I think that feeling of they've kind of lost that trusted, person in their life. So I think that was something that was, that we really heard a lot about. And I think the practitioners felt similarly. I think they informally we were following up or were having follow-ups, but wish that had been more of a regular part of their service, is sort of the follow through. We also heard a lot about gaps in service, particularly in the late spring or summer birthdays. For instance, like with first steps, if a child, turns 3, in the spring, but then they can't get into services with the public school until the fall. So we kind of heard a lot about sort of summer gaps. And then we heard a lot about the need for more, as I said, there was isolation, a need for more social support. And it seemed that families really enjoyed, any level of kind of peer-to-peer activities or events that were offered. Didn't seem to be offered very frequently, I assume, especially with the pandemic, but that was definitely a need that folks mentioned, not having the support and thinking that could even be a transition strategy if I don't have my home visit, if I knew other families like me, if I had other people to rely on too. So sort of seeing like social support as something that could be a transition strategy. Okay. So this slide is just kind of a highlight of some of the strengths and challenges. As I have said before, I think families felt really positively about the quality of services and their staff. They told us just amazing complimentary stories of the staff that they were working with. And just, again, feeling very like isolated. So that was a really critical support for them. I think another thing that was a real strength is that these services are really family centered. I think that was something that came up in terms of transitions, that they felt like their infant toddler program was very family centered. And then when they transitioned after their child turned 3, that the service became very child centered and sort of feeling that, where do I fit kind of feeling. So just this sort of like a paradigm shift from that family centered to child centered. So we heard a lot about that. Another strength that that we identified really is that the home visitors are really serving sort of a navigation community navigator or connector. So really are the critical resource to get families connected with other resources in the community. So some challenges, some have been talked about already earlier in the meeting too, especially to do with sort of workforce challenges. So I think that's just across the board, it seems like in every field, but really having challenges with home visitors and providers in different communities. So having trouble just having the staff you need to make those referrals. And as a result, having pretty high caseloads for the home visitors. So that can be really challenging when they're both in the home providing home visitation services and trying to coordinate all these referrals and transitions that we're talking about. So that's kind of a whole other layer that can be really cumbersome for staff. Again, having sort of not always having the services convenient or close by to families, particularly medical services and specialized medical services was a gap. Another thing too, I think I sort of mentioned a lot of families experiencing trauma. And so feeling like there may be the need for kind of cross-system professional development around trauma-informed care, including like medical providers and sort of all our early childhood partners benefiting from that sort of support. Okay, I think we can move to the next slide. So in terms, that's sort of very highlight of what we kind of heard directly from families and practitioners. So the next steps here, we'll be developing a written report that will be a lot longer than all of that I just shared. And the infant and toddler work group will be the one to sort of take all of those findings and develop recommendations for consideration. So as I said at the beginning, the 0 to 3 goal is for policy recommendations, but we've really identified that there's a lot of different kinds of policy recommendations. There could be some big P policy recommendations. One example, something that 0 to 3, I believe has mentioned is the idea of if it would be helpful to have a legislative study, for instance, to look at rural healthcare, since that was something we really identified through this study. And then there are so many small P or smaller P policy changes or recommendations that could come out of this. Like we were just talking about potentially joint professional development, for instance, amongst and across the system. Data sharing, just all kinds of ways that as partners, we could develop policies to help. And then also the opportunity to focus on equity. So looking at how we can improve access in different areas for families, especially families with special needs. And then also how we could mobilize our regional collaboratives to support some of these issues that have been brought up. And then looking at how the GOEC and partners can provide TA and support as these develop. So I think that's it. So it seems like the next step will be draft recommendations that would go to the investment and alignment group. And then they would, as I understand it, they will take it from there. Any questions?
Hello, this is Amy Hood. I don't know if you can hear me.
I can hear.
Okay. And you may have addressed this as you were beginning, and I apologize, but as I was looking at the programs that you evaluated, I was curious as to, was Early Head Start not included in your review?
It wasn't. Yeah, that's a good point. We did focus on sort of home visitation models, but I know Early Head Start does have home visitation as well. So
Yes.
that might be a good suggestion for kind of the next phase of this work, potentially expanding to look at other projects like Early Head Start.
Right. Early Head Start, I mean, they do have, and it depends on what part of the state they're in, but there are several home visiting models of Early Head Start. I would suspect you'll find some of the same some of those same kinds of, things, but I think it should, it is something that we have. So I think it's something that should be looked at. Thank you.
Yeah, no, thank you. I think that's a great suggestion, and we're making note of that as a follow-up. Thanks.
Since access was
I can repeat if your question, if you.
Since access was one of the biggest issues that you saw, I can remember when this project first started because I was still working in my office every day when we were initially asked to identify somebody from our team to be a part of it. But a huge portion of it has taken place during the pandemic when most of us were operating from home and everybody shifted from face-to-face to telehealth and things of that nature. Prior to the pandemic, access was an issue, but since the pandemic, the number of referrals, particularly for First Steps and other therapeutic services, occupational therapy, speech pathology, those kinds of things, access has really changed because so many children have been referred now that they're kind of reentering the community. When you talk to the families and they talked about difficulties with access, was it from a pandemic perspective about how many referrals are happening now, or were these families that had access issues prior? Because I know there were some. I have a son who has weekly occupational therapy, and I'm terrified if I miss my time slot that they'll give it to somebody else. But I also know how many people are on wait lists, even in Lexington, where I live, which is a resourceful community compared to a lot of places in the state. If you go in for an evaluation for OT, PT, speech, there are enormous wait lists now because of the number of children who have had increased referrals during the course of the past 2 years.
Yeah, we were talking with families that were current or previous participants in the program, not so much folks that are on the wait list waiting for the program. But we did talk to them sort of about telehealth versus in person, and some of them have received both over time as well. I think in some cases, telehealth has really helped access for some services. Others, like physical therapy, for example, it's not going to work. And so it sort of was an example of where it kind of works for who it works for. And that helped with some access issues, but certainly, created others as well. So, but it sounds like, do you feel like it would be helpful to be able to get feedback from folks that were on the wait list about access, or what were you thinking?
I'm not even thinking access.
Oh, okay.
I'm not thinking wait list. I'm thinking the people who entered during a pandemic
Yes.
lifestyle and
Yeah.
had difficulty scheduling since that point versus it was an issue before. How badly has it changed? Does that make sense?
Yeah. And so I think we saw with First Steps, for instance, them going to a coaching model for families. So in some ways, I think the telehealth model, that worked where they could get families, and if they had other kids at home, they were able to do that like through telehealth. So I think for some it worked, and the others it didn't work as well.
It's just a variable we can't take out.
Yeah. Yes.
It happened and it's part of it, but is it because of the typical model, or is it because of the changes that have occurred?
Right. Yeah.
And I never want to stifle conversation and discussion because I think that's part of it. And as we go through and we're looking at the rich amount of information and for the programming that we have for these to continue on, and this may be something we can push into one of our work groups and then hopefully continuing our work as we move forward. But in the interest of time, if we can, because we're coming up at 4:30 and we have a kind of a hard stop at 5. Want to make sure that we do get all the information out to the members today that are here in the room. We can continue on afterwards, drinking a cup of coffee and talk about those, but also want to make sure being mindful of where we're at. So I think next is Dr. Cunningham. Are you up next for the next slide? If we can ask you to go ahead and make your way up to share the information on the updates and refresh for the profiles.
Great, thank you. I'm pleased to be here with you in person this afternoon, and I wish I had one of those great sweatshirts. So Amy asked me to come today to kind of discuss a little bit about the most current data around kindergarten readiness to third grade proficiency. And then also something that we've been working on in conjunction with RENA and the Shared Accountability Committee on some revamp of the ECP, the Early Childhood Profile. So hopefully you are aware of the profile. I see many familiar faces in the room, and I've heard familiar names on online that I'm going to date myself a little bit around this work because our first ECP was back in 2013, and a lot of members around here were involved in picking the metrics that are involved in that ECP and what we put out there. And we're very fortunate here in Kentucky to have what we have in our early childhood profile. But some of the conversations that went on, and Amy and Rena can speak to this a little bit more than I, was around, maybe kind of paring down the early childhood profile information so that we could provide more of a bird's eye type view for counties who may not need or want or be paralyzed by that much data in one place. So I think we went past the first slide here. Well, anyway, there was a 5-year trend. So kindergarten readiness has been relatively flat over the past 5 years, hovering around that 50%. And if you look at the chart here that you have in front of you, and hopefully those online can see it as well. And I know you can't see the numbers particularly, but you can see, and you can't see the writing, but you can see the trends. So if you look at that top line of bar charts, those are the kids that weren't ready when they were starting kindergarten. And then we're looking at their 3rd grade proficiency scores in 2021. So this is the most recent cohort that we have available to us, and that will be incorporated into the early childhood profile that will be updated in June. So you'll see in these trends that you're more likely, the kids who are not ready by kindergarten are more likely to stay behind by 3rd grade. And so I think that's some of the talking points that we've talked around in the Shared Accountability Committee, the importance of kind of that early intervention and that early childhood space. So if you'll go to the next slide. So that's reading and math. Math looks the same kind of trends as what you see in reading. And so the early childhood profile is on the next slide, please. I know we're running out of time, but we're good. Okay. Okay. So I just want to go through a few of these metrics that are on here in this kind of pared down version of the early childhood profile. And we want to definitely get input from this advisory council because you guys were, very integral in the first and transition and involvement of the ECP. So what you're seeing here is you can see that we're keeping kind of the kindergarten readiness scores, both overall and domain. What you're seeing here is a state level. We'll still provide it to be drilled down by the county. And then further down on that page is what you see here next. And those are the charts that I just went over. So looking at that link between kindergarten all the way to 3rd grade and what their proficiency is in 3rd grade. And then a few metrics here at the bottom, maltreated children that are reported, and that's a state level. Births that are low weight, kindergarten readiness, and then here is 3rd grade proficiency in math. We can add reading, we can do an overall percentage proficiency, whatever we feel like is best. And then the next page kind of gives an overall picture of, sorry, if you can go to the next page, thank you, gives an overall picture of kind of the quality. So that first pie chart that you see is the quality. And then the next charts you see are looking at preschool and Head Start readiness, the percent ready that participated in Head Start and preschool, and then those that did not participate but were likely eligible based on the data that we have for them in kindergarten. And then finally, enrollments and capacity numbers for childcare, CCAP, preschool only, Head Start, blended. And so those of you who are aware of the early childhood profile, you know that pares down a lot of the information that's in that current version of the ECP. So we wanted to make sure that we brought this to the committee to discuss if this is a direction that we want to go, if this is a something that we want to provide as an executive summary in addition to what we currently produce within the same report, or how we want to handle that. And then I'll let Amy kind of talk about, identifying bright spots and talking about strategies and how they want to communicate that information in conjunction with this profile. Yeah.
So, of course, we just so appreciate Dr. Cunningham and her team. They're wonderful to work with. We've got Anita Dowd, who worked on Shared Accountability Committee with us, Scotty, Dr. White, Amy Smith. So you all jump in, right? Rita Gratz chaired the committee. We convened the Data and Shared Accountability Committee over 6 months ago. And the reason we did it is because, as John mentioned, we have a 5-year strategic plan. There was a big piece in there around developing and implementing an accountability plan that incorporates birth to 5 milestones to increase kindergarten readiness rates, right? So when we look at the early childhood profile and data we have, which is, as Dr. Cunningham said, people are so envious of Kentucky, let me just say, when they see our profile and they see all of our data. But what we see is that we've got kindergarten readiness, and collectively, we're not working together before kindergarten, right? Okay. So our committee was like, how do we do that better? What are those milestones? How do we do that? And so we did a lot of digging around that. We worked for about 6 months, and we uncovered a lot along the way, I feel like. And a lot of nuggets. I feel like a lot of things we said, like, here's, I think, how we can improve the work. We talked a lot about underutilization of high quality services. We talked about so Danville, they presented today during lunch. They're doing some really incredible work. And so we also sort of, we heard from them during 1 or 2 meetings, and we saw some of the sort of like data visualization they're using, and it's very pared down. It's sort of very like going back to the original early childhood profile in 2013 is sort of what it looked like, right? Bar graphs and subdomains and sort of those types of things. So that's really what you see. And those are the recommendations that came from the Data and Shared Accountability Committee that are just coming right here to, to you all just to share. But again, it's back to the basics. It's about underutilization of services. And let me see what else. User-friendly. Absolutely user-friendly, pared down, a more sort of like narrowed scope. This is sort of like a funny story I like to share is in May, it'll be 2 years that I've been here. The first year that I was here, I received an email when the early childhood profile went out, not from Dr. Cunningham's office, somebody on my team. It was like, by the way, the early childhood profile's out, and that was it. And back in the day, it was like bells and whistles and parades, and the governor was talking about it. And it was like, we got to get back to that, right? Are we all using the profile? Okay, I got to go. It's 15 minutes. So what data do we need? What data do our community partners need to move the work forward? Not every piece of data that is birth to 5, but what's the narrow data that we need to move the work forward? That's what you see here. So anybody else that was on the committee that wants to add, please jump in.
Yeah, I can add. I'm speaking loud enough, my teacher voice. So just to piggyback on what both Dr. Cunningham and Amy said,
the idea really is to help local communities to understand that kindergarten readiness begins prenatally. And that's a part that the community does not get grasped in terms of actionable data. And so what what our desire was, to start this work was to begin with the wonderful treasure trove that we already had in the early childhood profile and refresh that and transform that into something that communities, regional collaboratives, and the community at large will use at all levels to begin to really move the needle to help them identify what are the priorities for us locally. Is it underutilization? Is it a lack of seats? At what age? Is it developmental screeners? What is it in our local community that is the need? And what data do we have on that? And in this profile, thank you so much, Dr. Cunningham and your team, amazing folks to work with. They really tried to work with us to distill down, and the whole committee had a lot of discussion about distilling it down to what will start the conversation, because this is not all the data. This is the beginning of the data. But what we want is for this piece to start the conversations, not just within the early childhood space, but to engage the rest of the community in data that they can look at and not be befuddled by that. Like, what in the world are they talking about? So when you add pieces like, maltreatment numbers and the actual numbers of kids that are enrolled in Head Start, in public preschool, the state of childcare in the communities, then you can have real conversations, on the ground conversations about, okay, where is our need right now and where do we need to focus and who do we need to have at the table to rally around these data pieces. And that is organically what has happened in some communities like Danville. And that's what we need to replicate across our state. So that is the goal of this. So.
This is Amy. I don't know. I hope you can hear me.
We can hear you.
Okay. It's really hard for me to see, on the screen, and I'm really sorry that I couldn't be there in person today. But again, I just have some questions about this because, with the early childhood profile, it has been used, and we've, people around in our part of the state really do use it for lots of different data points and data sets. One of the things that I'm having a hard time capturing here is, does this capture all of the child care programs? Because what I'm seeing is it just says high quality early childhood. So is there a specific set you're looking at? Because really we can't understand the whole picture if we don't look at all of them, whether they're a certain level or not. And then my second question is, it talks about Head Start eligibility. I just want to be clear again, in my mind, when, be very clear, is it Head Start birth to 5 or is it truly preschool? And should that be broken down? Because just as she said, Head Start, school readiness really does begin prenatally. So we cannot leave out any of that prenatal or the early years. And I'm not sure that's captured based on what I can see.
Mm-hmm. So I think to answer your first question about the high quality early care education programs, so those are all that are rated that you see on the current early childhood profile. So all the data that you see in this refresh is data that you can get from the current profile. Now, in terms of the Head Start eligibility, if I remember your question correctly, you were talking about incorporating early Head Start. Is that as well as Head Start? Is that what your question was, Amy? Yeah.
Yes, because sometimes people say Head Start and they are saying birth to 5 Head Start, but then some people say early and some people say preschool. I want to make sure it is comprehensive.
Yeah, I think that's a great point. And I think we actually need to make that clear on the refresh dashboard. So that's really good feedback. And that's the type of things that we need to hear for sure.
And with that being said, that's one of the values that we have of being here together, is looking at the robust amount of data. And I just know a little bit of what all you guys have. And you are, like Brenda said, the KY Stats is a gem to have within the state, very responsive. And as members, if you have questions or if there's things that we need to look at on the profiles, that is an opportunity we have. In the interest of time, you can put those in the chat and we can capture those, or send an email over to the office. That way we can field those. But I do need to go ahead and move to our next section of our meeting because we do have a voting matter that we want to make sure that we get to. And we have about 12 minutes within our time spot. So we're going to go ahead now and transition over to priority 2 with Megan Greenwell, and she's going to give us an update on the RFAs for the regional collaboratives.
Thanks, John. Okay, so today we'll be voting on the release of the RFA. So you'll recall that in 2019, the Early Childhood Advisory Council voted to streamline and align what we used to call community early childhood councils to the workforce investment boards after an extensive evaluation process and recommendation findings. And so we reduced the number of single councils to regional collaboratives to support best practice and provide new opportunities to provide greater impact. At that time, the regional collaboratives were divided into 37 different collaborations, and we currently have 32 active ones. And as Amy mentioned earlier, she said we have 3 new. Well, while we're here at the Institute, we now can say that we have 4 new. So we are officially, that means we are 36 out of 35, out of 37. We are one away from being a full capacity regional collaborative. That's exciting news.
I
was busy okay. So again, this is just a reminder of the goals of the regional collaborative, essentially alignment from birth through 5, all the programs, reducing duplication, leveraging resources in order to meet the common goal of a strong start for our kids. Collaborating with KY Stats, and as you can see, it's really, really important to do that on the early childhood profiles in order to connect those services that we know work well for those touch points along that birth through 5 pathway. Investing in data-driven solutions, and you heard about Bright Spots today, to help local communities with innovative solutions and decision-making. And lastly, affecting change to make measurable progress towards the goals of that particular community that they've identified from data from the early childhood profile and other local data sources.
So our first key change for this RFA is that it's going to be a funding for 2 fiscal years. And this is huge for us because it gives us an opportunity to really scale up investment. It allows us to pivot from one-day activities to long-term behavior change. It allows us to build more specialized action plans for our regions based on the needs, collect more data, provide extra assistance in gap areas for regions, build resources and plans to help child development and school readiness. It allows us to be more proactive and gives more opportunity for sustainable impact. So historically, the application is still non-competitive. The goal is to move the needle of kindergarten readiness for the entire state. And the same formula will be used as has been used in the past, which was adapted based on total child population and child population in poverty with a cap of 50,000 per county. And the formula is 35% based on under age 5, 45% based on under age 5 living in poverty, and 20% split equally across the counties. And so, do you have any questions there? Okay, let's hand it back to you.
Question. Have the collaboratives already been formed?
Yes, ma'am.
And they're gonna apply as a collaborative?
Yes.
Okay.
Yes. So another key change is the simplified application process. And when you get to take a look at this, you will really see the brilliant work that Megan has done to make the application process very seamless and very intuitive for the collaboratives. we are also really gearing the collaboratives towards long-term change and those data-driven strategies and away from one-shot or one-day activities. So what we want is long-term behavioral changes in the community. And also, another huge thing that we're doing is making sure that we are seeing that collaboration across the community. So we want to see evidence of that in the application. So promoting not just the collaboratives to work together across districts and with partner agencies in the community, but to make sure that there is a unified approach. And then the third piece that we worked on is really ramping up that technical assistance. We know we want that to be accessible to everybody and making sure that all the work is aligned towards ready families, ready communities, and ready schools. So again, the application process has been refined based on alignment with the regulation, to promote equity in the ability of collaboratives to write strong grants, and with the data-driven strategies. And particularly one of the things that we'll be focused on in the technical assistance sessions is the writing of SMART goals, because we're asking for collaboratives to write SMART goals that are driven by improving child outcomes specifically, not just action for adults. We did so many PDs. Well, what are the child outcomes and family outcomes associated with that?
Question again, Annette. Back to that other slide where you had 3 areas, every child can have a strong start in the Commonwealth, ready families, ready communities, and ready schools. Each applicant, collaborative action, will address each one of these. How are they gonna do that? I know.
They're gonna make sure that the programs that they are going to put in their plan will address one or more of these.
One or more.
Yes.
That's correct.
So another big change that we are excited about is our proposed funding. So last year, the Governor's Office of Early Childhood received additional tobacco settlement dollars, which will be infused into our regional collaboratives. And so this was based off framework that said the regional collaboratives would invest in best practices through local innovation, address the most underserved communities with an emphasis on infants and toddlers, plan more for sustainability and matching dollars from key stakeholders, and again, move to those longer term plans from one-day activities. And so we are proposing this time that the regional collaboratives receive up to 3 times their original maximum amount in July of 2022, and then again in July of 2023. And this would allow the regional collaboratives to have a bigger impact from the start, plan for sustainability, move from those one-day activities, and it gives us a chance to really be proactive. So I put an example up here on the board. The regional collaborative is ABC, and it is made up of 3 counties. The counties are listed and their maximum amounts are listed as well. But if we gave them up to three times the amount, originally the regional collaborative ABC would have received $18,600. With this proposal, they would receive $55,800 in July of 2022, and then again in July of 2023. And again, you're voting today on the release of the RFA. And this information is in there, but again, you'll vote in June on the actual dollar amount. So again, we wanted to start with equity, and we wanted everyone to have the same opportunity and everyone to be successful, because we all here share the same goal, which is to get more kids in the Commonwealth ready and prepared for kindergarten. So we're really increasing in collaboration effort and support through blending and braiding of resources, through our webinars, which will highlight excellence in the field, through these early childhood institutes, sustainability planning, continuous improvement and support, through our KY Stats partnership. We're going to have a walkthrough for this. If this webinar is approved today, we already have a webinar scheduled for Friday to walk the regional collaboratives through each step of it. And office hours are going to be available throughout the whole time. Are there any questions? So today, if pending approval, the RFA will be released on Monday, March 21st. Again, we will have a webinar on March 25th for the Regional Collaborative Chair and Fiscal Agents, where we will explain the RFA page by page. And then the application will be due April 30th, all electronic this year. And we will vote on approval of funding June 16th back here at the Advisory Council for the exact dollar amount. And then the funds will be available July 1st for the regional collaboratives. Are there any questions?
Okay, at this time, what we'll be moving to is for a motion to approve the release of the RFA for the 2023-2024 fiscal years. Remember, this is a 2-year process. For those that are joining us by Zoom that are ECAC members, just a reminder that you need to turn your camera on for the voting, as this is one of our fiscal duties that we have as these ECAC members. But if you can, I need someone to make the motion to approve the release of the RFAs for 2023-2024. Okay. We have a motion to release the RFAs. Is there a second? I have a second. Amy Smith. All those in favor say aye.
Aye.
Any opposed? All right, so the approval will go forward. So we'll release those RFAs that will be coming out tomorrow, and then the webinars will be going through. Team, I cannot tell you how much the work that they did. We went through that was lightning speed. However, I know I'm on borrowed time. What they have done to go through to get the RFAs to do it for a 2-year and to leverage the funds to fund back the regional collaboratives. And you know that saying 2 out of 3 ain't bad. 36 out of 37 ain't bad. But we'll use peer pressure to get the last one to get there. So thank you very much for the work that you've done, for all the presenters. I know that we will be heading out here in a moment. Continue the conversation on. As we close up today, that call to action is going to be very short. ECI is important. That's going to be coming around the corner tomorrow, I believe. If it hasn't already gone out, will be the save the date for June 21st and 22nd. It's one of our responsibilities, one of our privileges to come back here and represent our local communities as we serve the children and families of the Commonwealth. And as you heard, for the approval of our funding, our next ECAC meeting will be on June 16th. I believe it'll be back here in person, possibly. It'll be June 16th. The location will be to be announced. I was on, see, that's what happens when I go rogue. So Rodin's going rogue, right? But thank you all so very much. Those that joined online, thank you very much. I hope you have a wonderful day. And if there's no objection, we will be adjourned.